am Dr. Sandeep Chatrath. I am the Regional CEO and Group Medical Director of Metro Group of Hospitals. And I have been working in healthcare as CXO with all the leading brands like Apollo, Fortis, Wockhardt, Gangaram during last 3 decades. And I am very happy to be part of this sixth CXO Digital Innovation Healthcare Summit 2021, and I'm happy to deliver the keynote address today. So, friends, what has happened is that during the COVID times, we have all realized the importance of digital and importance of how the digital transformation has helped us in delivering better healthcare, especially during COVID times. And healthcare has suddenly become a very, very important part, just like national security. And we have seen then the budget on healthcare, which was only 1.2% of GDP, has during the last budget been increased by more than 127%. So, health has become like a very integral part, very important part, and the digital marketing which has happened during the COVID times is of a very high importance, because in our group in metro hospitals we have seen that the importance of digital marketing and how we are promoting during the hospital services during the COVID times, because it's social distancing as well as contactless traveling, and without having move out you can promote your services. So digital marketing has become a very, very important part through the use of technology. uh, Also, I want to highlight about the virtual consults and the telemedicine, because this is where the future is. And COVID has suddenly expedited the transformation and more adoption of virtual consults as a platform for consultation and for delivering healthcare. And telemedicine has, as well as the digital consultation, have become very, very important parts of the healthcare delivery. Uh, Zoom meetings and the conferences being done on a digital platform has become the part of daily day-to-day activity. And earlier we were not that much using Zoom and digital platforms for conducting conferences, webinars, and that has definitely happened during the COVID time. And I think future is it's going to grow only. The virtual consults, the teleconsults, and Zoom meetings, it is there to stay. And I think digital technology has a very, very important part in this transformation. Also, we have observed that this disruption is catalyzed through the technology, and the catalyst for the disruption, COVID, has helped in more wider adoption of technology. And definitely, I think now we are coming from the survival to the revival approach after the COVID pandemic has gone down and vaccination going on full flow. So definitely, I think revival approach. And in this, I feel that the electronic health records, which is again a very big key point, which we have seen wider adoption to the technology during the COVID transformation, is there to stay and grow. So EHR adoption, electronic health records adoption has gone to the next level, definitely. And definitely, I think that there are more data sharing practices which has all happened due to the analytics and due to the COVID pandemic, and where the technology has played a very, very important role. And definitely, I think remote working, working from home, is definitely again one thing which we have realized because anything which increases the efficiency and effectiveness of our working and saves on transportation, saves on unnecessary travel, saves on fuel is definitely there, and I think it's all technology enabled and technology driven only. So I want to highlight about the use of artificial intelligence, which has happened during the COVID time also. But specifically, overall, we have seen that the artificial intelligence has become a very important part in the healthcare delivery, and more accurate mechanisms of predicting epidemics like COVID will be possible in future through the use of artificial intelligence. Definitely, I think that the artificial intelligence usage in healthcare is going to grow leaps and bounds, and it is going to be one of the most widely used technology in healthcare. As we have seen, now it is widely used for accurate cancer diagnosis, for the there are cure checkers, and there are symptom based algorithms, and I think analytics have been given a big boost through the artificial intelligence, because data mining and how we are able to analyze it in a shorter period of time through the artificial intelligence, that is again digitally enabled, and I think that is definitely where the future is going to be there. We are able to diagnose septicemia, identify rare bacteria through the use of artificial intelligence. And definitely, I think in future also we will find that the treatment and the cure part is also going to get very much magnified and improved through the use of AI. AI powered radiology and imaging, because especially we've seen that in MRI, when you are doing MRI, you are comparing the scans and you are analyzing what takes 4 to 5 hours on a manual working happens within few minutes through the use of artificial intelligence. So I think AI powered radiology is definitely going to stay, and is definitely where the future is going to be there. India, friends, has a highest incidence of cardiac diseases, and I think by the usage of algorithms and by the usage of risk screening through the AI, we are now in a position to predict heart problems in a faster way, in an early way. And I think if we are able to determine the risk scoring and take proactive steps, we can prevent heart problems. And I think artificial intelligence has given a very big boost to this screening and early detection of cardiac disease. There is definitely, I think, robotic surgery, which is AI based, where the future lies. And I think all hospitals have adopted it as contactless surgery during the COVID times. And I think it is definitely going to get the further boost in future healthcare delivery. Overall, we've seen that the performance improvement, access improvement, improvement in quality of care, cost reduction, higher satisfaction of patients, all is possible through the usage of technology, and where artificial intelligence also plays a very big role. We are seeing that the consumers are using now digital tools in healthcare more widely, and more importantly, I think this has become a sort of a norm. And research and advanced analytics through the AI, patient risk identification, diagnostic assistance and medical imaging, drug discovery, cyber security, and primary care, the triage, all getting the boost through the use of artificial intelligence. And definitely, I think this is going to stay, and it is going to further improve with time. We have seen that the artificial intelligence and machine learning has a huge scope in healthcare, and there is big data mining and advanced analytics usage through the AI, which is going to be there for future. Connected sensor enabled devices and wearables are definitely now high in demand. We have seen wide usage of Apple watches, where we are able to preempt and understand the risk storage by wearing a simple technology enabled intelligence enabled watch. Next generation genomics and robotics and telehealth are definitely, I think, where the future of healthcare is digital. This is what I want to highlight, because that is definitely a technology driven, and it is definitely artificial intelligence helps in early detection. And this is definitely, I think, going to be, and also artificial intelligence helps in earlier and better medical diagnosis. We are able to also use AI for nursing assistance, and I think here also for the medical assistance, the use of AI is definitely going to be there. AI also helps in better decision making because of better analytics, and we know about Da Vinci robot and how it is able to have a better surgery experience for the surgeons. But definitely, there also the AI has played a great role. Machine learning, definitely, and the deep learning. These are the two areas of future where we are investing now for future. And I think definitely this is going to have a huge impact in future for the healthcare delivery improvement and for the healthcare improvement. And regarding this budget for the healthcare, I think this budget was really very good for healthcare, because during the budget a very big push and very big impetus and focus has been given to healthcare. There is strengthening of existing national as institutions and new institutions for the detection and cure of emerging diseases. This will be in addition to the National Health Mission. And definitely a very high focus has been given on clean water, hygiene, sanitation, vaccination, nutrition, and preventing pollution. These are the key focus areas which are all related to healthcare, which have been focused during the budget. Government has announced 64,180 crore for the boost of health sector, and we have seen that 2,23,846 crores budget outlay for health. And so there has been a earlier budget was for the 94,452 crores. So there is an increase of 137% on healthcare. Prime Minister Atmanirbhar Swachh Bharat Yojana is being launched now, and total outlay of 64,180 crores will be spent on this over a period of 6 years. Government will provide nearly 35,000 crore for COVID-19 vaccination, and India doubles healthcare spending. That's a big achievement, and I think that's something which is very much the need of the hour. And government has also opened up the insurance sector, because in our country the penetration of insurance is pretty low and it's less than 30%. And now with up to 74% uh, um, uh, opening up of insurance sector for the private players, definitely I think the health insurance will get the further boost and impotence. Health outlay to be used to establish critical care units and hospital blocks, and government has announced 17,000 rural and 11,000 urban health and wellness centers. So wellness is one thing which has been given a very big boost during this visit, during this budget. And integrated public health labs are being set up in the districts. Mission Poshan 2 to improve the nutritional outcome across the country has also been launched. And especially I like to highlight about the pneumococcal vaccine, which has been given a lot of focus during this budget. And made in India pneumococcal vaccine, because it was available only in 5 states till now, and now it will be available across the country. And this will be able to prevent nearly 50,000 deaths annually, pneumococcal vaccine. So that has been given high focus. Setting up of higher education commissions of India and responsible for accreditation and regular funding of medical colleges, because India there is scarcity of doctors. Setting up of virtual universities, and also 4 national institute of biologies have been announced during the budget, and special bridge courses will be there for pharmacists, nurses, technicians, paramedics, and caregivers, and proposal to attach the medical colleges with the districts hospitals on the PPP model, I think is a very important initiative. So I think these are the key focus points which government has highlighted and has captured during the recent budget. And I think this budget is definitely focused on healthcare delivery. Thank you very much.
For more updates from CXO TV, please like and subscribe to our channel.